Hello, good afternoon, everyone. Hopefully you can hear and see me okay. I hope you found the morning and the first half of this afternoon useful and being able to connect with some of our experts across the seminars and exhibition halls. You may have been with us a little bit earlier in the Italy seminar room, but for those who missed it, my name is Seb Bampton and I'm one of the business development managers here at Europe's Home. For this session, I'm joined by Debbie from IMG and ALC Europe Healthcare. Debbie will be sharing her insight and knowledge into the healthcare systems in European countries. Thanks for joining us, Debbie. It's great to have so many of you here, whether you're listening live on the day, also joining us on demand. This whole event is designed to support you, the overseas buyers, and provide you with the right guidance and connections, and to give you an opportunity to get some of your questions answered about how to move overseas and purchase property safely. Once Debbie has shared her presentation, there'll be a time for your questions to be answered, but throughout the whole session, you will be able to ask those questions on the right-hand side of the screen under the Q&A section. So please do fire as many of them over to us as possible. Debbie will try and get around to answering them as much as she can. But if we don't have the time to complete all of them, please do go across to Debbie's booth, IMG and ALC Health, where you'll be able to spend a bit more time on a one-on-one basis discussing your unique plans of how Debbie and her team can help. All the exhibitors today have a wealth of information on those booths, loads of documents, videos, and you can also download them on demand after the event. But we'll move now across to Debbie. So yeah, Debbie, as I said, thanks so much for coming to join us. Would you mind just giving us, I suppose, an introduction to yourself and a little bit of information about AOC and IMG Europe?
Absolutely. Thank you, Seb. So yeah, I'm Debbie West with ALC Health and IMG Europe. So we're an overall company of IMG. Yeah, we've been around for, gosh, nearly 29, 30 years, I think now, all in total. I've worked with the company for about just over 6 years now. So we're quite a large team within all different countries within Europe, mainly based in the UK, but we've got a representative in France, Spain, Germany, and mostly all parts of the UK. So if I'm just going to share my screen now, actually, and then we can sort of go through the presentation. As Seb said, if there's any sort of questions, pop them through on the chat, and we've got some sort of Q&A time at the end of the session after my presentation. So feel free to ask away.
Thanks, Debbie. I'll let you know when I can see your screen. It hasn't popped up yet. Ah, perfect. Yeah, I can see it.
You see that now?
Yeah, thanks.
Okay. So just a brief presentation today. It won't take too long to go through, but just give you sort of a flavour and an overview of the health insurance products. So just to firstly say, obviously moving abroad can be really expensive with many associated costs, and health insurance obviously being one of them, being quite an important one as well. We have to look after our health. Most countries insist on expats being insured. That's something that IMG, we can offer a range of plans that also meets the visa requirements, and also options that we can help sort of keep the cost down, i.e. sort of adding a policy excess onto your plan. So even actually where there's local state health cover is available, many expats and digital nomads prefer to ensure that they have access to first-class treatment at the best facilities. And that's one of the things that ALC and IMG offer. You can have treatment in any GP surgery, specialist, hospital or facility within your chosen and purchased area of cover. So if that means you've chosen a European plan, that means it's Europe and UK included. And if you chose to then therefore need treatment which is eligible under your plan that you've chosen, if you wish to gain treatment, say in a top Paris hospital, top UK London hospital, then that is actually okay. You're able to go there. We don't restrict on any particular network. So our plans, so there's visa letters, which show that your visa appointment for proof of adequate cover. We have an easy application process, and quoting prior to that is very simple as well. As I mentioned before, there's an option to add a policy excess, which reduces your upfront costs. And obviously this is subject to particular visa, which visa allows. Some countries need an excess, some countries don't require an excess. Also gives freedom to have treatment in your new country of residence or return to your country of nationality, i.e. if you're Italian moving to France, that's absolutely fine to go back to your national country. If you're British moving over to Spain, France, wherever it might be, that's actually also okay to come back and have treatment in your country of nationality. And there's also an easily search for nearby trusted medical facilities in your new country of residence via our customer portal. Please excuse my voice today as well, everyone. I just seem to have a little bit of a cold that's unshakable at the moment, so bear with me. So we've got 4 choices of underwriting. So our bronze underwriting, this means that any medical condition that existed prior to your date of entry is not covered and never will be covered. And this only applies to our lowest entry level, which is our bronze plan only. The other plans we have, which range from bronze plus, silver, gold, and platinum, the highest level, we can offer these 3 following underwritten plans. So full medical underwriting, or FMU as we like to call it for simplicity. So this is where we'll ask for details of your medical history, and based on the information we received, we will confirm what terms we are able to offer you and any exclusions that may apply. Moratorium. This is where we do not cover treatment for any medical conditions that existed during the 5 years before your start date of our policy. However, after joining, all eligible pre-existing conditions may be considered if you have been free from treatment, medication, symptoms, and checkups for a continuous period of 2 years. So, for example, if your start date is the 1st of April, you have to go, therefore, the next 2 years, symptom, treatment, medication free, before, if there was a flare-up of that particular condition, after that then time where we'd consider covering that particular condition. And lastly, continued personal medical exclusions, CPME. So this is where if you've been already insured, or you are already insured with a different provider, i.e. could be AXA, Bupa, Now Health, and you'd like to transfer through to ALC or IMG, if you were medically underwritten in that particular policy you're currently on, we may agree to continue any personal medical exclusions onto your policy. If you were on a moratorium basis, we may agree to maintain the original moratorium start date, and your policy will remain subject to our general terms, including the exclusions and benefit limitations. So with our new plans coming on board, everyone would have access to our members portal. So this is where, through your onboarding email confirmation and letter, you'll have a link and you can register with my ALC portal. So within this portal, you'll be able to gain pre-authorization for treatment, so inpatient treatment you might need. Easily submit and manage your claims online, really simple and easy process. You can also download a copy of your certificate and your policy wording, which is your declaration of insurance. You can read secure messages from our claims team. So we're our claims team if you submitted claims, where they might need to email you back with requests for more, maybe another medical report, more information, etc. Secure messages can be found and seen and read via the ALC portal link. Within this, you can also search for a medical facility. So if you're unsure of where you might need to gain treatment, or if there's a specialized a surgeon in a particular town or city, you can search for those medical facilities. You can also obtain useful travel and security information, and you can start a web chat and access the secure premium payment area. So if you need to send payment through, for example, like a monthly or quarterly amount, and you need to update your credit card details or bank details, this is where you can do that safely. So just a couple of highlights on our plans we offer. So multiple plan options to fit your budget and cover requirements. Choice of area of cover. So we have 3 of those. We've got Europe, worldwide excluding USA, or worldwide for anyone that does need medical coverage in America as well. Just to note on that, there may be a co-insurance if you do take out worldwide coverage and need American care. So there's terms and conditions that might apply for coverage within America. There's flexibility to include additional benefits such as dental and maternity if you feel you want those covered as well. Freedom to choose your own healthcare provider within your chosen area of cover. So as I explained slightly earlier on, if you chose to come back to the UK and see a top London clinic, top London facility, then that's absolutely fine. We offer 24/7 medical helpline for emergency assistance and advice on treatments. And there's no age limits or lifetime renewals. So once you have a policy with us on board, we will renew your policy for as long as you require. Children can be included on your policy up to the age of 25. Over the age of 25, they would then in turn sign their own application form and have their own individual contract with us. And something else just to point out as well, innocent bystander, we do offer treatment of conditions or injuries received as an innocent bystander during acts of terrorism are covered unless you're involved in any illegal activity. And on behalf of IMG and ALC, thank you so much for attending and listening. Thanks so much.
That was great. Yeah, thank you so much. Such an important part of the process. It's great to have your knowledge and expertise to go through exactly how IMG and ALC Health can assist clients. So yeah, thank you. And again, just going
Pleasure.
back to the audience, and you did well to battle through with a bit of a cold as well. So double thank you and well done. Yeah, so going back to the audience again, please feel free to put your questions in the chat. I can see there's around 35 of you with us. So yeah, please do ask questions at the Q&A section. Debbie, I've seen there's about 4 questions here, so I'll pick out a couple and put them towards you. So we've got one through here from Roberta Cole. Probably quite a difficult question to answer without knowing individual circumstances, but Roberta wanted to get an idea about how much different policies would cost.
Okay, thanks for your question. That's a really good one. What we'd only need is the country of residence and the person's age, and then we'd be able to offer costs. It's a little bit tricky. Obviously, every country might have different IPT included. So we'd need to sort of just know your country of residence and which area of cover. If we're looking at the sort of lower area of cover, so Europe, Obviously, the costs are a little bit lower than if you need worldwide or worldwide excluding coverage. But certainly, Roberta, I'm happy to sort of drop you an email later or give you a quick call. We can then just sort of go through the people on the plan, potentially, you know, their age and country residence, and give you a very sort of simplistic quote for now.
Thanks, Debbie. Yeah, just to echo that, Roberta, you know, say everyone's plans are different. I think it'd be good to have an in-depth discussion with either Debbie or a member of her team to kind of get more information about your plans and, you know, how that could actually relate to costs for you. Roberta did actually follow up with another few questions. I don't know if you can see them there, Debbie, but the next one
Yeah, I
was
see them there. Yeah,
around
thank you.
travel insurance.
Yeah,
I think,
so if someone was to take the Europe policy plan, obviously that wouldn't give you details for or a coverage for anything sort of medical in North America. But what we can do, we have an additional short-term medical plan, which is called Globe Hopper. So if, for example, you took one of our annual policies and then needed to travel, we do have a sort of a short-term medical coverage, which we can then cover you for that those North American countries. So yeah, certainly we can look at either way. And certainly what I'll do is I'll drop you a note later, Roberta, and we can touch base, and I can give you some sort of rough prices, etc., and some idea of coverage and the short-term plan, Globe Hopper, on your trips to North America.
thanks.
And I see your next question as well. Sorry, is there a maximum age for starting? So no, there's no maximum age. It might just sort of boil down to particularly the underwriters of which particular plan of underwritten terms that we would offer you depending on your age. But certainly if we touch base sort of offline and we can chat through some options. Hope that's okay.
Thanks, Debbie. Yeah, thank you, Roberta, for your questions. We've got one here from Colin Clark. He's asked, has the NLV in Spain requires a 12-month policy from date of entering Spain, but do you know if that will be, she doesn't know at what point that will be. Can you prepay for a policy to start on an unknown future date and receive a policy document that confirms this?
Yeah, certainly. I mean, the plans can start anytime really. If you do sort of apply for one of our plans and need to sort of shuffle back the start date, by all means we can look at that for you. That's no problem there.
Great, thank you. Thanks a lot, Debbie. We have one here from Kelvin. He says, if you're applying for any of the various types of visa available for staying in Spain, will you need to arrange insurance cover for healthcare? I believe so, but I'll let you answer that one, Debbie.
Yes, yeah, I believe that Spain obviously is one of the countries that you do need the health insurance coverage for that. Once again, we can sort of drop through some more detailed explanations for you if you like, Kelvin, offline.
Yeah, great stuff. Yeah, I think you say everyone's plans are unique and individual to themselves. So yeah, definitely worthwhile having a more detailed discussion on a one-on-one basis. But yeah, thanks so much for the questions that have come through so far. I have a couple of questions that came through, Debbie, before this session, as we asked our audience, if there's anything they'd like to know. Obviously, Brexit was a huge part of how clients can move overseas and purchase property. A lot of changes to the legal side of things, but also healthcare policies and things like that. What has changed, fundamentally since Brexit?
I missed the last sentence you said. Sorry, Seb.
That's okay.
My phone's cut out.
I was just asking what are the main changes around healthcare in Europe since Brexit?
Obviously can't talk for any other providers out there, but certainly for us, legalities in the background, as us being an insurance company, we've made sure that we have the regulatory tick boxes in place as such. So certainly we can continue trading within the EU. That's absolutely fine. We have the legalities in the background, as I said, that we can sort of carry on with that. Not really sort of sure in particular. I mean, our health insurance plans haven't really changed as such, because we are an international health insurance provider. Our plans still remain to be accessible and used within the world, pretty much. Obviously, down to sort of each individual's person's plan that they take, i.e., excuse me, Europe or worldwide. But I think it's, yeah, I think we've just kept strong in the market out there. Our plans are very competitive. You know, we're covering inpatient, outpatient, evacs, as I said before, the sort of optional benefits like dental and maternity. And yeah, I just think that we, you know, to sort of cross the I's and dot the T's, our grandparent company as well has sort of put financial backing into us. So we have the sort of regulatory forms completed in the background that still abide us to be able to sell worldwide. So I think that's the main thing.
Yeah, great. Yeah, so I think
Okay.
you know, it's so important to hear that you're still able to assist clients. You know, there's a lot of uncertainty around healthcare, especially when moving overseas, and it's, you know, so important that people feel like they have the freedom to move overseas and the comfort that they're covered on the health side of things. So thank you, Debbie. We have another question on the similar lines around Brexit that's come in from Ivor. Can you please update us on the current EHIC healthcare provisions post Brexit? You may have touched on it just then, but is there anything else at all, Debbie?
Not that I'm aware of at this point in time, no. But that is a really, really good question. If I'll need to just reassess that one with my manager if I can, just to sort of clarify if there is anything else in relation to the EHIC.
Okay.
So let me take that offline, and we can certainly share that with people slightly later. I don't want to give sort of false information right here, right now. So I'd rather clarify that offline and get that determined.
Yeah, not a problem. Yeah, I think better to say that the right thing instead of the wrong thing. But Eva, yeah, great question. And yeah, please do visit you know, the IMG and ALC booth after this, or, you know, arrange a time maybe next week for a more in-depth discussion to get your answer to your question. We've had another question come through just now, Debbie, from Jackie. She mentioned that she claims her pension now. So assuming I can get an S1 form, what does this cover? And then she goes on to ask, also, my partner is younger than me and not claiming a pension, so he would have to get private care. Can this be done on our NLV, both being different?
That's also really good questions. Once again, I would need to take that offline and just double check. But certainly any of our, I think regardless of whether you're pulling a pension or not, certainly our health insurance, excuse me, can cover, as I mentioned before in the presentation, you know, anyone of any age. It's obviously just subject to the actual terms and conditions of the plan that you purchase with us. So that might mean that, you know, you need European cover only. As mentioned before, that does also include the UK. On a double plan, so say for example where there's a couple of partners on the same plan, that's absolutely fine. You can be on different age brackets, that's absolutely fine. As mentioned before, it's just down to the individual person's age, so the premium would be valued at that particular person's age and country of residence. And if your partner, as you mentioned, is a lot younger, then the premium value is set for that particular person's age as well. So, and that's regardless of whether you, you're living in the UK or whether you're living abroad in a sunnier climate.
Thanks, Debbie. Yeah, which I presume most of the clients and attendees in the seminar will be hoping to do fairly soon. We've got a bit of a grey skies here in London, so I don't blame any of you. But yeah, thanks for your answer, Debbie. And again, yeah, I think it just reiterates the point that it's worthwhile having more in-depth discussions on a one-on-one basis, because there's so many different policies and variables when it comes down to healthcare overseas. But great, very good question, Jackie. Thanks very much. Um, Again, we'll go through to some of the other questions that came through, Debbie. One of them is fairly generic, but it's good for the audience to get an idea of the process. As it's such an important part of the process, when would you advise clients or attendees actually get in touch with IMG and ALC?
Certainly. I mean, yeah, anyone can either sort of message in the chat box later on. We can take personal details offline and chat either by phone, email, WhatsApp, etc. later on. But yeah, I mean the team here, we're all here to support anyone that needs it at any time, really. So
I mean, is there
by all means, if people need quotes in the next week, in the next month, in the next year, that's absolutely fine. Our company's been around for many years. As I said before, it's about 29, 30 years. So yeah, whichever team member picks up and can give you a call back or email you. But certainly, I mean, I'm happy to share our generic sales inbox if people want to sort of keep that on board. And email as and when they come through. If you do, obviously just let us know that you've been an attendee of your overseas home event, so we know where your inquiries come from. But yeah, I mean, happy to share details now if you like, or later.
Well, what we'll do, Debbie, say at the end of the event, we will pass your details and company details across to all of the attendees and vice versa to make some time with one another to arrange meetings and things like that. But yeah, that's so it's a good idea. Yeah, going back to the question around timings. A lot of the audience perhaps are unsure about when to get in touch in preparation for going across and viewing trips and hopefully moving overseas into their new homes. At what point within their search of a property or their planning of buying a property would you advise that they actually get in touch with yourself?
I mean, that's purely down to each individual person, how they feel. I mean, obviously, if you want a policy with us to start slightly before you move out, then that's absolutely fine. Obviously, you're sort of purchasing of a policy, or sorry, purchasing of a property, I should say. Could be pushed back. So in turn, you might want your health insurance start date to be pushed back as well. So I mean, it's really up to you. Depends on sort of when you need your international private medical insurance to kick into place. Obviously, people based in the UK, we've got access to the NHS system, but from a private medical point of view, if you want that to start immediately, and then if you're not sort of moving out to Italy, Spain, France, wherever it might be, until months later, then that's solely the individual's sort of preference. Or if you'd like it to start the week before you move out, that's totally up to each individual case. So yeah, it's purely down to individual preference, really. That's what I'd say. Yeah.
Okay, cool. No, it's interesting because a lot of services that the more time you have, the better. But if it's up to the individual, of course, whenever suits them in their journey of moving overseas. But yeah, thanks a lot, Debbie.
Yeah, no problem.
We'll,
I'll just sort of maybe add to that as well. Obviously, with a health insurance policy, if your start date is in a couple of days' time, and as long as the premiums have been paid, then that start date effectively is when it kicks into action. So it can be quite quick. So yeah, it just purely depends on those individual person's needs as to if they feel they want to get something sorted and it's ticked off their list and then they can move on to the next thing they need to sort out, then yeah, by all means. But we can certainly start quoting. I know a couple of people have sort of mentioned on the chat about having an idea of cost. Certainly we can do that very quickly for you after the call as well, either by email or chat, or I can pick up the phone and give you a quick tingle back. Certainly, as I said before, it's sort of costs are based on whichever plan you choose from and the person's country residence and age. That can be a very, very quick indicative price for you. That's not a problem. Then we can sort of go from there. We can always do requotes if you like down the line. Okay.
Thanks. So yeah, I think there's a few questions that popped up around quotes and prices. So thanks for answering them. We've got one final question that's just come in from Felicity around actually would she need to have a medical examination or anything in regard to get a policy? No.
No, really good question. Thanks, Felicity. No, we don't send you to have a full medical prior to you applying for us. So no, that's absolutely fine. Yeah, of course, if there are a couple of different variable questions, if the underwriters might need a little bit more information of potentially something that's happened in the past or on a medical condition, they might ask for a little bit more information. But certainly we'll, case by case, the underwriters come back to us if they do need a little bit more medical information to ask. But certainly, yeah, you don't have to have a medical prior to purchasing one of our plans.
Brilliant. Thank you. Yeah, thanks for listening. Thanks, Debbie. One question just come through. It's around prescriptions. So if someone has prescriptions at the moment, for example, let's say blood pressure tablets or medicine, do the policies cover prescriptions abroad, or can they?
Yeah, that's another really, really good question. It would actually sort of come down to initially your underwritten policy to begin with. So it depends on what you're declaring as a pre-existing condition. But certainly we cover prescriptions and prescriptions abroad. That's absolutely fine. So any of the plans, medical benefits that are on can be used anywhere. So within your area of cover. So that can be, yes, if it's an eligible condition, eligible treatment, prescriptions can be placed abroad, no problem. Yeah, and that can be in, I guess, even a different city. So if you gain a prescription in one town and then you need to pop to a different town to get that fulfilled, then that's absolutely fine. Yeah.
Brilliant. Yeah, great question, and yeah, very good answer. Thank you so much. Yeah, I mean that kind of sums up. We have no more questions that have come through from this, but I actually have one myself, Debbie, which you kind of alluded to it on I think one of the first or second slides around dental care. So, I mean, in regards to that dental care, is everything covered within that, or is it a policy by policy basis in regards to what I actually am covered for overseas?
Yeah, so if you take out the routine dental plan with us, there are sort of a couple of variations covered in that. So it depends on whether it's a routine dental checkup or something a little bit more substantial, like extractions and things. So once again, the optional dental benefit can be added onto your plan. There's an additional premium for that. And then it would be subject to specific sort of benefit criteria. So depending on what you're having covered, whether that's just sort of routine fillings, x-rays, checkup, etc., going down to root canals, things like that. So the plan is sort of subject to the treatment you're having, and then what's reimbursable under that, and obviously which plan that you end up purchasing. But once again, obviously, once we, if and when people want quotes, then we'd, sort of provide the benefit structure so that you can go through at your leisure of what is covered and what benefit levels, yeah, under each benefit.
Perfect. Yeah, thank you, Debbie. And yeah, so thanks for everyone for all the questions throughout this session. So it's been really insightful for myself, and I hope everyone in the audience has found it useful. Please do go across to the IMG or ALC booth. They are in all exhibition halls, as they can assist with all countries. They are one of our trusted and recommended partners. So please do talk to them around this part of your move. And yeah, say book onto those one-on-one conversations either today or elsewhere further down the line. But if you've got any questions, reach out to your overseas home team or Debbie directly. So we will pass over all the contact details. And yeah, finally, Debbie, to you, thank you so much for your knowledge and insightful presentation. It's been really useful, and we wish everyone all the best on their property searches. And thanks very much for joining us today.
Thank you, everyone. It's a pleasure. Thank you so much.
Thanks, Debbie. Cheers.